somebody to show the way.
And now let's move over to the next topic, National Immunization Schedule. We can write it as NIS. What is this National Immunization Schedule? Just a brief overview about the historical aspects which may be asked in your exam. So beta, in 1974, we started with the EPI, that is the Expanded Program for Immunization. Then very smoothly and slowly, way back in 1985, we started with the UCIP, that is the Universal Immunization Program or the Universal Child Immunization Program. In both these programs, that is the Expanded Program for Immunization and the Universal Immunization Program, technically we were dealing with 6 vaccine preventable diseases. What does VPD stand for? Vaccine preventable diseases. So we were handling 6 VPDs. What were the 6 VPDs? That is the diphtheria, pertussis and tetanus, DPT. Plus we were also giving the oral polio vaccines. So this makes like 3 and 1, 4 plus measles and tuberculosis, that is BCG. Tuberculosis, that is BCG. So total 6 vaccine preventable diseases were there under these programs, that is the EPI. So then in 1992, we started with the pulse polio immunization for the first time, that the whole country is going to take all the polio vaccines at the single day, at single time. So that was to promote herd immunity. The concept of herd immunity was promoted for polio vaccines. And then somewhere in year 2014, we started with the Mission Indradhanush. What is there in this Mission Indradhanush? Beta, please note that in the Mission Indradhanush, this is Indradhanush. What do you mean by Indradhanush? It is a rainbow, right? So Indradhanush has 7 colors, and that was the Mission Indradhanush. It was basically 7 colors. That means 7 vaccine preventable diseases. So that means what? So it is the 6 vaccine preventable diseases plus another one, that is hepatitis B, was included in this program in year 2014. That is what is the 7 vaccine preventable diseases. Alongside, this can also be the question that what was the objective? The objective of Mission Indradhanush was to have 100% coverage. But of course, 100% coverage is practically not possible, but at least a more than 90% coverage. Immunization coverage was expected from this Mission Indradhanush. To have 7 VPDs and to have the 90% coverage, the government had said that the mandate is that at least more than 7 visits will be required for child till 5 years of age. So you can just remember that Mission Indradhanush was 7 visits for 7 vaccine preventable diseases, and we wanted 90% coverage. And this was the logo for the Mission Indradhanush. You can just see, look at the logo. Then very soon after Mission Indradhanush, now currently what we have is intensified Mission Indradhanush. What is intensification of this Mission Indradhanush? The intensification of Mission Indradhanush is to promote immunization coverage in all the areas which have lesser immunization coverage. So primarily it was more district, please mind it, district-based approach. So different approaches were used. It was more primarily like districts which were having less immunization coverage and districts which have more. So you budget them accordingly. So the intensification of the Mission Indradhanush was started in year 2017 onwards. So every year we will have some different rounds. Currently what we are following in India is the intensified Mission Indradhanush version 4.0. So this was launched in February 2022. In this intensified Mission Indradhanush MCQs, we are supposed to have 3 rounds of immunization. Primarily, the goal is to have 100% immunization, but of course, we cannot achieve 100% immunization. So for that, what is our reasonable target? We want to have more than 90% coverage across the country in all the districts. So the current value for coverage is something ranging around 70% coverage we have in India. So it's around 68% coverage for immunization is there in India. The third point that can be asked to you in the intensified mission Indradhanush version 4.0 launched in 2022 is that how many districts we are tackling? We are tackling 413 districts out of the 744 districts that we have in the whole country. So 413 districts out of all the 33 states and union territories, they are under this intensification of the mission Indradhanush. The target is to achieve more than 90% coverage in all the districts. So currently, whatever I'll be talking to you is the intensified mission Indradhanush version 4.0 targets for you. So all the data that I have taken, all the images shown in this video module, they have been taken from the National Health Mission guidelines. We have also taken from the Mission Indradhanush operational guidelines. We have also taken the MCP guidebook for health workers, the MAS, that is the Mahila Arogya Samiti guidebook, National Health Mission, Ministry of Health and Family Welfare, Government of India, the intensified mission Indradhanush 2020, 2021, 2022 guidelines have been taken, and the training of the trainers for the frontline workers, bridge guidelines have been taken. So these are the resources that have been used in this chapter. Let us talk about the National Immunization Schedule for your exams. In the National Immunization Schedule, please note, we are going to give some vaccines at different diseases. First MCQ, how many visits are there? Please note that the child is going to come to us for birth level immunization. Then at 6 weeks, 10 weeks and 14 weeks, the child is again going to come. Then again at 9 months of age, 16 to 24 months of age. Then at 5 to 6 years. And then at 10 to 16 years, that is the total time for a child to come. So can you see that how many visits are there? I can see. So the first MCQ is total how many visits you see. Beta, for the visits in children age less than 16 years. Total you can see that 1, 2, 3, 4, 5, 6, 7, 8 visits are there. If the question says under 5 years, so till 5 years we are having 7 visits. Plus there is one added visit during pregnancy in case the person is a pregnant and she's female. So in a pregnant female, the vaccine we are giving is a TD vaccine. So total how many visits, if the question says total visits, as per the National Immunization Schedule is 8 for children plus 1 for pregnant female. So total visits would be 9 visits. If the question says that how many total diseases are being tackled, please note that under the program we are tackling total diseases which are tackled are 12 diseases which are tackled under this program. These are the 12 VPDs. You remember that way back in 1974 we started with an expanded program for immunization. We had only the 6 vaccine preventive diseases. Then in Mission Indradhanush we had the 7 VPDs, right? We added hepatitis B. So now I am saying that in the intensified Mission Indradhanush guidelines we now have 12 VPDs. So what are those 12 VPDs, beta? We are giving for tuberculosis, that is BCG. Then we are giving poliomyelitis, that is OPV. Then it is for hepatitis B, that is you're giving the hepatitis B vaccine. Then it is the pentavalent vaccine. Pentavalent takes into account D, P and the T, that is diphtheria, pertussis and tetanus. Alongside it also has H influenza, Haemophilus influenza B. H influenza B. Please note H influenza B is for meningitis and it is for pneumonias also. So H influenza B is responsible for childhood meningitis and for pneumonias. So primarily there are 2 diseases in it. But you can say that H influenza B borne diseases. Next in line, we are also giving the rotavirus vaccine. Rotavirus vaccine. 9th is the pneumococcal diseases. Pneumococcal diseases. We are giving the pneumococcal conjugate vaccine. 10th is, alongside we are also giving the measles, and 11th is your rubella. So in almost all the states we now have the measles rubella vaccine, and the last one, 12th, is given only in selected districts. So it's with star mark, that is the Japanese encephalitis vaccine. So total beta, how many VPDs you are tackling? You are tackling 12 vaccine preventable diseases. So that is what is the national immunization schedule. Please note there are 9 visits, total 9 visits, plus there are 12 VPDs we are tackling under this intensified mission Indradhanush. So now coming over to what is the national immunization schedule. If I just write down national immunization schedule, so what are the vaccines to be given at what all ages, the examiner might ask you now. So beta, please note that at birth, what are the vaccines we are giving? At birth we are giving, please say with me, what are the vaccines we will give? We will give BCG, plus we will give oral polio vaccine 0 dose, plus we will also give the hepatitis B vaccine birth dose. Please note that we are going to give the hepatitis B vaccine birth dose and the oral polio vaccine 0 dose. It's not oral polio vaccine birth dose. It is not hepatitis B 0 dose. Mind it. So the words are important. Then at 6 weeks, 10 weeks and 14 weeks, what are we going to give? Please note we are going to give the pentavalent vaccine. We are going to give the pentavalent vaccine, pentavalent 1, pentavalent 2 and pentavalent 3. What does PV stand for? Beta, please note PV is equal to the pentavalent vaccine. So I'll just be discussing what all is in the pentavalent, but right now let us write the schedule. First of all, pentavalent vaccine. Alongside pentavalent vaccine, we are also giving the oral polio vaccine. Oral polio vaccine is given as 1, 2 and 3. That is at 6 week, 10 week and 14 week. Why do we say oral polio vaccine 1, 2, 3? Because the oral polio vaccine 0 dose was given at birth. Plus, very recently, we have also started, along with the pentavalent and the OPV, we have also started giving the rotavirus vaccine. RVV stands for the rotavirus vaccine. Rotavirus vaccine. So please note that very recently, we have also started the RVV vaccine. It is given in the dose of 1, 2 and 3. Plus, alongside the rotavirus vaccine, we have also started the FIPV. What does this FIPV stand for? FIPV. Please note FIPV stands for the fractional dose of inactivated polio vaccine. Inactivated polio vaccine. Please note it is the killed form of the polio vaccine. You have a live form, that is what is the oral polio vaccine. You have a killed form, that is what is the IPV vaccine. So at IPV vaccine is given at what all ages? Please note it is given at only 6 weeks and it is given at 14 weeks. It is not given at the 10 week. So we are giving pentavalent, OPV, rotavirus plus IPV, plus very recently we also started with the PCV. PCV stands for the pneumococcal conjugate vaccine. PCV stands for the pneumococcal conjugate vaccine. Pneumococcal conjugate vaccine, that is what is PCV. Please note that the PCV is also given at 6 weeks and 14 weeks. It is not given at the 10 week. So what are we going to give at birth, beta? We are going to give the BCG, OPV, hepatitis B at 6, 10, 14. At all these 6, 10, 14 weeks. We are going to give the pentavalent, the OPV, the rotavirus vaccine, the fractional IPV and the pneumococcal conjugate vaccine. Next in line, the child will come to us at 9 months of age. What are we going to give at 9 months of age? We are going to give the measles rubella first dose. Alongside measles rubella first dose, we will give the vitamin A. Plus, we will give the pneumococcal conjugate vaccine booster dose. At 9 months, we give the pneumococcal conjugate vaccine booster dose. Plus, we recently started another vaccine, that is the Japanese encephalitis vaccine first dose. Please note, I'll write it with a star mark that it is given only in selected Japanese encephalitis endemic districts in India. Next in line, you have is the 16 to 24 months of age. At 16-24 months, what are the vaccines you're giving, beta? You're giving the measles rubella 2 vaccine. Plus now the booster dose will start. 16-24 months, the child has already attained 1.5 years of age. After 1.5 years, all the booster doses or the second doses will start. So we are giving the second dose of the measles rubella vaccine. Alongside the second dose, we will give the DPT booster. Alongside 16 measles rubella 2, we will give the DPT booster. Plus we also give the Japanese encephalitis second dose with a star mark. Why? Because it is given only in Japanese encephalitis endemic districts. Then at 5 to 6 years of age. At 5 to 6 years of age, we give we also give the OPV booster at 16-24 months of age. Then 5 to 6 years, it is only DPT booster. And then 10 to 16 years, we give the TD vaccine. So beta, this is what is the national immunization schedule. MCQs on this national immunization schedule for you now. First MCQ, which of the following are the live vaccines? So how many live vaccines do we give in the national immunization schedule? I'm just going to highlight those live vaccines. We are going to give BCG. BCG is a live vaccine. Then you have the OPV. Again, it's a live vaccine. And then you have the rotavirus vaccine, which is again a live vaccine. And then you have the measles, rubella, and the Japanese encephalitis. So total, how many vaccines we are giving, which are live vaccine? Please note that the live vaccines are total 5. First MCQ is regarding this. MCQ number 2, regarding this vaccines. So the second point is, what about the birth vaccines? If you talk a little bit in detail about the birth vaccines, please note that about the BCG vaccine, questions can be asked. That BCG vaccine, it's a amber colored vaccine bottle, amber bottle. Why do you think it is amber colored? Because the BCG is sensitive to heat and light both. It is both heat and light sensitive. I would also like to tell you that BCG is given at birth, right? So BCG, what is the dose that we give at birth? Please note that the dose, if somebody asks you the general answer, please note you have to mark as 0.1 ml. It is given as intradermal injection. Where do we give the BCG? In the left upper arm. It is given in the left upper arm. Right? So that is the dose. But now the MCQ will ask you that what is the dose at birth? If the MCQ asks you dose at birth, please note that in India, the child is very small, right? The weight of the child will be very less. In India, the average weight is only 2.8 to 3 kilograms. So the skin of the baby is very soft. So if you're giving an intradermal injection of even 0.1 ml, that may cause the rupture of the skin. So the dose at birth is said to be 0.05 ml, half of the 0.1 ml dose, and this dose is given till 1 month of age. 1 month of age. So I just want you to know that for BCG there is an issue that the birth dose is different and the adult dose is different for BCG vaccine. BCG prevents what disease? Please note it prevents the childhood tuberculosis. BCG will prevent the childhood tuberculosis. What is the max age for giving BCG vaccine? The maximum age that we can give BCG vaccine is till 1 year of age. We do not, in the national program, we do not give, even in private sector also, there is no requirement of giving BCG vaccine for children age more than 1 year of age. So that was a brief regarding the BCG vaccine. Coming over to the OPV vaccine, 0 dose. What was the OPV vaccine 0 dose? Just now we discussed about the OPV vaccine 0 dose. It is given at birth. So this OPV vaccine 0 dose, please note that the dose is same, that is 5 drops. But this 0 is called as 0. Why? Because there is OPV 1, 2 and 3. We do not say OPV birth dose. We say OPV 0 dose. So because there is OPV 1, 2, 3. What is the maximum age for giving the OPV 0 dose? Please note it is 15 days. That means if a child is born today, you're supposed to give the BCG and the OPV. But if the child is saying that, if the mother is saying that the child was born 3 weeks back, so if it is more than 15 days old child, then we do not need to give the OPV 0 dose. So that means if a child is reporting to you after 15 days, you are going to give only 3 primary doses of OPV. If the child is given OPV at birth, that means you're going to give 4 primary doses of oral polio vaccine. So please note OPV 0 dose. On the same principle, there is something called as the hepatitis B birth dose. What do you mean by hepatitis B birth dose? Why don't we call this as hepatitis B 0 dose? Because we don't have hepatitis B 1, 2 and 3. We are giving hepatitis B along with the pentavalent vaccine. So hepatitis B is given at the birth. Why do you think we are giving at birth? Primarily, will it prevent hepatitis B in the child? Of course, it's going to prevent hepatitis B in the child. But the point to be noted is that the hepatitis B birth dose may have chance to prevent the mother to child transmission. So it prevents the MTCT, that is mother to child transmission of hepatitis B. So that is what is the beauty of this hepatitis B, that if this is a child, you're giving hepatitis B to this child, even if the hepatitis B has come from the mother, like through the perinatal route, so transplacental route also, the hepatitis B may be prevented in a child if you give the hepatitis B vaccine, provided it is at the birth. So MCQ which can be asked is like, what is the max age for preventing mother to child transmission? Please note that the max age for hepatitis B birth dose is to be given within 24 hours. So what did you learn, beta? Hepatitis B to be given, birth dose to be given within 24 hours. OPV 0 dose to be given within 14 days or 2 weeks, and the BCG should be given within 1 year. If it is given within 1 month, dose is 0.05. If it is given after 1 month, dose is 0.1 ml. Both are intradermal injections for BCG. So having done this, now what you can do is you can make a single table like this. In this single table, we are going to write down almost everything that you need to remember for your exam. This will be the summary table for your exams. So beta, different columns will be there. In the first column, you're going to talk about the type of the vaccine, the dose of the vaccine, the route of the vaccine, the site of the vaccine, the max age we can give, and what are the remarks or the side effects you want to write. So these are the columns you need to make. I would like you to make in your own copies, because there will be many things beyond the table also which we are going to write down. So talking about the first vaccine, that is the BCG. BCG is given at birth, you all know. The type is, it is a live vaccine. The dose is, you all know, it is given as 0.1 ml. If the MCQ says at birth, what is the dose for BCG at birth? Please note it is 0.05 ml till 1 month of age. That's what it is, till 1 month of age. So but in this summary table, we are not going to write that. What is the route? Please note it is intradermal route. The site is the left upper arm. You are going to give in the left upper arm. The max age for BCG vaccine, we can give it till 1 year of age. And what are the side effects? The side effects of BCG vaccine is general, like the side effects of BCG vaccine. It is general lymphadenitis, which can even happen after 1 month till 1 year. So it can happen after 1 month of vaccination till 1 year. Anytime lymphadenitis can happen. Of course, the most common side effect is simple fever and scar formation. However, most common side effect is simple fever and scar formation for the BCG vaccine. So the side effect, you can write it as lymphadenitis as one of the important side effects. Regarding hepatitis B vaccine, please note that what is the type? Hepatitis B vaccine, it is a recombinant vaccine. The dose is 0.5 ml. It is given where and how? It is given as intramuscular injection. It is given in the anterolateral thigh left side. What is the max age for giving the hepatitis B vaccine? Please note it is only till 24 hours. Frequently asked question in your exam, it is given till 24 hours. What is the side effect? There is no side effect. Like, of course, there is no vaccine which has no side effect. Anaphylaxis can always be there. Allergic reactions can always be there. So by writing no means, it does not mean there is absolute no side effect. You can remember that no means there is anaphylaxis. Anaphylaxis can work as the side effect every time. Next is OPV vaccine. MCQs on OPV vaccine. Beta, please note OPV is a live vaccine. Dose is 5 drops. It is given as oral vaccine. There is no route. It is given till what year? It is given till 5 years of age, unimmunized child. But I hope you remember that if the OPV is given at birth, it is given only till 15 days. Otherwise, the OPV in child, it is given till what age group? It is given till 5 years age group. So these are small things that you need to remember for OPV. And what is the side effect of oral polio vaccine? There's a VAP. What does VAP stand for? VAP means vaccine associated paralytic polio. It stands for vaccine associated. So vaccine associated paralytic polio. That is what is side effect of the oral polio vaccine. Pentavalent vaccine. Please note, talking about the pentavalent vaccine. Pentavalent vaccine, it is a mixed vaccine. Next is, what are the constituents of the pentavalent vaccine? Pentavalent vaccine contains diphtheria, pertussis, and tetanus, right? That is what is the DPT, plus it also contains the H influenza B, that is Haemophilus influenza B, plus it also contains the hepatitis B. So that's what is pentavalent, 5 things, pentavalent. So if you talk a little bit more in detail about the pentavalent vaccine, please note that pentavalent vaccine, it is given as 0.5 ml intramuscular injection in the anterolateral thigh left side. So that is the route and site of administration of the pentavalent vaccine. But the point over here I would like you to understand is that the pentavalent vaccine has a problem of side effects. In this pentavalent vaccine, there is this pertussis component. The pertussis component is a killed vaccine. It is a killed component. Now, pertussis is known to cause, or has side effect of some neurological deficits. And it causes a very peculiar long-term persistent cry in the baby. So that is called as unconsolable cry, or unconsolable screaming by the baby. So this is usually for more than 3 hours. It could even be for more than 3 hours, like 4 or 5 hours. So we don't know exactly why the baby cries, but probably it is due to pain, or probably it's some problem in the CNS. Because if it was with the pain, then maybe for some children we could have given pacifiers, or some children would cry, some won't cry. But now when you see that maximum are crying, so that also is unconsolable cry. Probably it's due to pain, or it's because of some other neurological issue. It's hard to say, but that's what is the side effect of the pertussis component. And because of this reason, and now because the pertussis component, the killed pertussis component of the DPT or the pentavalent vaccine, it causes some neurological problem. That is the reason that pertussis or the killed pertussis or the DPT vaccine or the pentavalent vaccine, that is contraindicated in certain situations. It is contraindicated in what all cases? Please note, it is contraindicated in children with epilepsy, or with convulsions, or seizures. It is also contraindicated in children showing progressive neurological deficits, which show progressive neurological deficits. So if a child with cerebral palsy is there who does not have a progressive neurological deficit, you may think of giving the DPT vaccine or the pentavalent vaccine. But if in case there is a progressive neurological deficits, or there is progression of the neurological disease, then of course pentavalent is not advised. In those cases, what is advised? So for all the cases where the DPT is contraindicated, in those cases, what do we advise? We give the DTaP, that is the diphtheria and the tetanus with acellular pertussis. Acellular pertussis. What is acellular pertussis? That is without the cell. It is a protein subunit vaccine. It is a protein subunit vaccine. You remember in the last module we talked about the protein subunit vaccines. So these are a couple of things you would like to remember for the pentavalent vaccine. So now coming over to the pentavalent vaccine, what do you want to write in your summary table? Please note that it is a type of a mixed vaccine. Dose is 0.5 ml. It is given as intramuscular injection in the anterolateral thigh left side. Pentavalent vaccine, please note, can be given till what year? Under the national immunization schedule, the pentavalent vaccine can only be given till 1 year. I'm not saying that the DPT can also be given till 1 year. What I'm saying is that the pentavalent is supposed to be given only before the first birthday. So there are a lot of problems you will understand when we discussed about the unimmunized child. But please note, you have to take this understanding that if a child reports to you after 1 year of age, will you start? Focus on the word start. Will you start pentavalent? Answer is no. If the child already had taken a pentavalent 1 vaccine before the birthday, before the first birthday, let us say at 6 week, 10 week, whatever week, So pentavalent 1 was given, then the child did not come back. The child defaulted. Will you give the pentavalent 2? Answer is yes. 1 started, you finish. If you don't start, that is fine. Like if the child did not start till 1 year, that's fine. But if you started pentavalent, then you need to finish the pentavalent. So please note it is given till max 1 year of age. If started, even if started before 1 year, then if the child defaulted, you have to continue. So we never restart. We always resume the schedule. What is the side effect? We just now have talked. It has a lot of side effects regarding the pertussis vaccine. That is predominantly the neuro issues, right? Next is what is the rotavirus vaccine? Please note if we talk about this rotavirus vaccine, the rotavirus vaccine could be of many types. We can have different types, rotavac, we have rotacil, we have rotatec, we have rotarex. You can see rotarex. So in Government of India, in most of the states, many places we are using rotavac and rotacil. There is a innate difference between rotavac and rotacil. Rotavac, please note, this is what is a rotavac and this is with the dropper. So if you talk a little bit about the rotavirus vaccine, it is oral vaccine. You remember rotavac I told you? Rotavac is given as drops. How many drops we give? 5 drops. That is the general dose. If somebody asks you, what is the dose for rotavirus? Bhaiya, it is 5 drops. But if the question specifically, comma, quotes, the word is specifically. If the question specifically says that, let us talk about the rotacil vaccine. Is it given in some states? Answer is yes, it is given in few states. What is the dose? Is it oral? Yes, it is oral. It is oral vaccine. What is the dose? It is 2.5 ml. It is with a special injection. So after this session, in a nerd corner, I have made a special nerdy corner. So in that nerdy corner, I'll try to show you like how do we give rotavac and how do we give rotacil. But for your MCQ exams, if you're working in an intern mode, you don't need to do all that, right? So you just bother yourself, like what is the dose for rotavac? It is 5 drops. What is the specific dose for rotacil? It is 2.5 drops. It is very newly introduced in some states. Mostly in India, we are using rotavac, that is 5 drops. If you get a question, what is the dose for rotavac? Please answer 5 drops. Are we good with this? So you need to memorize this and you need to understand. Rotavirus, if we talk, what is the type? It is a live virus. What is the dose? It is 5 drops and 2.5 ml. But please note, if you get the single best answer, I would like to mark 5 drops. What is the route that we are giving? It is oral vaccine. What is the max age? Please note, rotavirus is also given till 1 year of age. All the newly introduced vaccine. You remember we had discussed about all these vaccines, all the newly introduced vaccines which are given in a different color. These are the new introduced vaccines. I'll just shade them. These are the newly introduced vaccines. If you talk about these newly introduced vaccines, they all are given till 1 year of age. So what are the side effects of rotavirus has been asked hundreds of times. It is intersusception. Intersusception, that is the intestine is going to go roll over itself. So that is a peculiar side effect of rotavirus vaccine. It has been asked multiple times. Intersusception is side effect of rotavirus vaccine. The next one is the fractional IPV. There are many doubts associated in the mind of students for fractional IPV. Please note that the WHO says give IPV. What is IPV? IPV is inactivated polio vaccine. What is this inactivated polio vaccine? Salk or Sabin? Salk is what is a killed vaccine. Killed vaccine is what is inactivated vaccine. So you can just remember it this way. The WHO says that we need, listen to the doubts now. I'm trying to solve your controversies. The WHO says that you should give IPV at 6 weeks, 10 weeks and 14 weeks or any time you give with a gap of how much? With a gap of 4 weeks. You give IPV with a gap of 4 weeks. It is usually given as intramuscular dose. So intramuscular will require 3 primary doses. But now you all know, you must have done it in your polio program where I talked that P1, P2, P3, you pull back P2, then you pull back P1, then you pull back P3 and you launch IPVs. Now IPV is kind of expensive vaccine. So now immediately in 2016-17, when we had that national switch day, the polio was withdrawn and we started with the IPV injections. IPV is kind of expensive, so that demand and supply was hampered. So the many countries in the world, they started thinking that why to give it as intramuscular, why not to try a intradermal dose. So Government of India, we in National Health Mission, we give a fractional component, okay? Fractional component of the inactivated polio vaccine, we give only 0.1 ml. The intramuscular dose is 0.5 ml, right? That's always standard. So intramuscular dose is 0.5 ml. In Government of India, what we are giving is 0.1 ml. So we are going to give 0.1 ml fractional dose. It is given as intradermal injection. It is given only in 2 doses, 6 weeks and 14 weeks with a gap of 8 weeks. It is given only in 2 doses, 6 and 14. It has been seen that if you give slightly more gap, the immune response of the body is going to be slightly more bigger. You remember we talked about the primary immune response and the secondary immune response. So that's what is the thing that you need to remember about the inactivated polio vaccine. So let's write it down for your summary for your exam. Please note that inactivated polio vaccine is a kill type of vaccine. What we are giving in Government of India, we are giving 0.1 ml. It is given as intradermal injection. Okay, it is given as the intradermal injection. Where do you think we are giving it? We are giving in the right upper arm. It is given in the right upper arm. What is the max age? I told you all these new vaccines. I already told you that all these new vaccines, these should be given till 1 year of age. So based on the same principle, it should be given till 1 year of age. Is there any known side effect we don't know about? Except from anaphylaxis and hypersensitivity reaction, there is no other major side effect from MCQ perspective for you to know. Coming over to the next most expensive vaccine. Do you know that PCV? Or the pneumococcal conjugate vaccine. If you talk about the pneumococcal conjugate vaccine. Beta, the pneumococcal conjugate vaccine, first MCQ, not the MCQ. In fact, you should know that it is a very expensive vaccine. In fact, it is one of the most expensive vaccine. Because it is very expensive vaccine, it was started only in few states. Then we found out does it have any effect or benefit over not giving a vaccine? What is the final impact on the population? You already know that 20 to 30% of the children will die less than 5 years of age because of pneumonias. It's a major killer, and pneumonia, 70% of the pneumonias are actually pneumococcal in origin. So pneumococcal conjugate vaccine, this is a conjugate vaccine. It's not a polysaccharide or recombinant. It's a conjugate vaccine, and it is kind of expensive, costing to the Government of India around 800 rupees. So just imagine that we have to give the pneumococcal vaccine to 2.5 crore population. So you can imagine that how much budget is being spent for the pneumococcal vaccine. So that is the reason this can be asked to you in your exam, beta. Pneumococcal conjugate vaccine, just very recently, a few months back, somewhere in last year, I think around October, November, probably the Government of India announced that we are going to scale up the pneumococcal vaccine to all states, all UTs across pan-India. So that's a very big news. So please note that now the pneumococcal conjugate vaccine is given in all states and union territories in India. What is the PCV vaccine that we are giving? In Government of India, we are giving a PCV 13, which contains 13 serotypes. You remember, pneumococcal conjugate vaccine and the pneumococcal polysaccharide vaccine, they will be serotype specific. So the pneumococcal conjugate vaccine is a 13 serotype vaccine that we are giving in India. Pneumococcal conjugate vaccine we are giving as 2 primary doses plus 1 booster dose. Right? So these 2 primary doses and 1 booster dose, they should be with a gap of how much time? Of more than 8 weeks. So that is what we are doing in a pneumococcal conjugate vaccine, and that is what can be your MCQ also in your exam. So let's just write it down for your exam. Pneumococcal conjugate vaccine, it is what type? Of course, it's a conjugate vaccine type. Dose is 0.5 ml. It is given as, pneumococcal conjugate vaccine is given as intramuscular in the anterolateral thigh right side. Till what age can we give pneumococcal conjugate vaccine? Just now we talked about all these new vaccines can be given till 1 year of age. There is no major side effect from MCQ perspective apart from anaphylaxis. Talking about the measles or the measles rubella vaccine. Just maybe a couple of days back, I think, I got a question from social media that why do we give measles and rubella combined? Why not to give measles and rubella? But yeah, in a country like India, it is very difficult to launch a new vaccine. It was very difficult for us to launch a inactivated polio vaccine. It was very difficult to make everybody understand that pneumococcal conjugate vaccine is important. So why to give two shots? It's only one shot, and we find that it is really working because the impact is there. So please note, measles or the measles rubella has been scaled up across the country. What are the MCQs you might get on the measles rubella vaccine? Measles and rubella vaccine, they both are live vaccines. The dose, it is given as 0.5 ml. It is one of the few vaccines which are given as subcutaneous. Please note. Lot of times it has been asked, it is one of the few vaccines which is given as subcutaneous. Where do you give it? Where do you give it? In the head, in the neck, in the arm, in the left, in the right, in the legs? Where do you give it? We give it in the right upper arm. Where do you think we're giving in the right upper arm? This side deltoid or the lower side? Please note it is in the lower side. Just a little bit above the elbow joint, right? So it is on the posterior aspect of the right upper arm. It is in the posterior aspect of the right upper arm. Please note that measles rubella vaccine is now given in 2 doses. Earlier we were having 1 dose only. Now we have started with the 2 doses. So to start the 2 doses, there was a special campaign for measles rubella second dose, which was introduced long time back. We had to go through a series of campaigns. This campaign is called as Keep Up. It is called as Catch Up, Keep Up, and Follow Up campaign. You just need to know that catch up means what? That means all children age under a specified age. So all children age less than 10 years, they were given extra dose of vaccine. Extra dose of vaccine. Which vaccine? Of course, the measles rubella vaccine. So if you give a measles rubella vaccine to all children age less than 10 years, of course, age more than 9 months, there might be majority of people who already were vaccinated, so they automatically will get a second dose vaccine. But there might be some people who did not take the vaccine, so they will be vaccinated for the first time. This is called as catch up. And then you keep up, then you keep on. Then you introduce the second dose and you give vaccine to everyone, and then you do the follow-up. So for your exam, let's keep it simple. This is old campaign. It may be asked, may not be asked, not very relevant from an MCQ point of view. Just you need to know that keep up, catch up, follow-up campaign was for what? It was for the MR second dose vaccine introduction. Right? So let's just come back to the MCQs about the table that we were drawing. What is measles rubella vaccine? We already studied it is a live vaccine. The dose is 0.5 ml. It is given as subcutaneous injection and it is given in the right upper arm. It is given in the right upper arm. Till what age we can give the measles rubella vaccine? Please note we can give it till 5 years of age. This has been asked multiple times that measles rubella vaccine can be given till what year of age? It can be given till 5 years. What is the side effect of the measles vaccine? Please note that the side effect or the adverse effect of measles vaccine can be first is most common, that is fever with measles like illness. So fever with mild rash can be there, that is usually the most common. The second is after measles vaccination, there can also be a very rare side effect, that is subacute sclerosing panencephalitis. Subacute sclerosing panencephalitis, which can be as a very rare, please note it is a very rare side effect of the measles vaccine. Most commonly, it is fever and rash with the measles vaccine, which automatically will go off. You don't have to do anything for managing the fever and rash. So it is a measles-like illness. So that is what you need to remember for your exam, that this can be one of the side effects. As far as the DPT vaccine is concerned, we already have talked about the DPT vaccine under the head of the pentavalent vaccine. There is a special MCQ on this. Please note, if we talk about the DPT vaccine, we already talked, it's a mixed vaccine. It is given in 0.5 ml dose. It is given as intramuscular in the anterolateral thigh, left side. We already did this. The only MCQ which can be asked is that, beta, pentavalent is given till what age? Pentavalent is given till 1 year. But if a child reports after 1 year of age, so what is the vaccine we are supposed to give? We are not going to give pentavalent. We are going to substitute pentavalent. We are going to give the DPT. It can be given till 7 years of age. So if the child is unimmunized for 7 years of age, till that time we can give the DPT. What is the side effect? We have already covered for your MCQ exams, beta. It is the pertussis related side effect. You remember, it is the neurological complications. As far as Japanese encephalitis vaccine, couple of questions are being asked on the JE vaccine. Lot of questions, not 2 or 3, lot of questions on JE vaccine. This is a 3 by 5 star MCQ topic for your exam. Japanese encephalitis vaccine, it is a live vaccine that we use. Beta, Japanese encephalitis vaccine, the strain that we use is a SA 14-14-2. This Japanese encephalitis vaccine is given only means only in the JE endemic districts. It is given only in the JE endemic districts. Only in the areas where Japanese encephalitis is a big problem or a big headache. So JE vaccine is given in 2 doses in the government of India with a gap of more than 3 months. That is important for your MCQ exam. There should be a gap of more than 3 months. So Japanese encephalitis, when do we give? We just now saw we give it at 9 months of age and then 16 to 24 months of age. That is the national immunization schedule for Japanese encephalitis. 2 MCQs now. This JE vaccine is given to what all age group children? Please note, it is given to all children below 2 years. But in case of unimmunized child, in case the child is unimmunized, it can be given below 15 years of age. So all children till age 15 years, they are eligible to take the JE vaccine. Very recently, the government has also introduced the adult JE vaccination, in which we are giving 2 doses of the Japanese encephalitis with a gap of 3 months. We are giving to the adults also. But that is not a part of the national immunization schedule. So that is just launched, very recently launched as a pilot project. But yes, you should know that earlier we were giving JE vaccine to all children age less than 15 years. Under the program, it was given till 2 years, but if the child is unimmunized, you give it till 15 years. And now, Government of India has also started JE vaccination for adults again in the same dose, like it's the same system, same regime. 2 doses are given with a gap of 3 months. So that is what you can remember for the Japanese encephalitis for your exam. Japanese encephalitis vaccine, it's a live vaccine. Dose is 0.5 ml. It is another vaccine which is given subcutaneous. And mind you, that's a 5-star MCQ for you, beta. That Japanese encephalitis vaccine is given where? What is the site? It is given in the left upper arm. Remember, it is given in the left upper arm. It is subcutaneous. It is given till 15 years of age. Every word has been MCQ previously. It is given in the left upper arm, subcutaneous. It is a live vaccine. There is no known major side effect for your MCQ exam. So these are some of the things you would like to remember for your exam. And now the next in line is the TD vaccine. A few questions about the TD vaccine. If you talk about the TD vaccine, beta, earlier we were giving the TT vaccine. The TT has been replaced with a TD vaccine. Why do we write it as a TD and not a TD? Because the tetanus component in this TD vaccine, it is usually in tune of 2 to 10 LF units. What does LF stand for? LF stands for the limits of flocculation. Limits of flocculation. So that's actually the units that we use for the toxoids in TD vaccine. So beta, the tetanus is 2 to 10 limits of flocculation. And if we talk about the D, the diphtheria component, the TD, the diphtheria component, it is in tune of 6 to 25 limits of flocculation. So this combined is what is forming as the TD with the capital D. Now, when I write it as TD, D, small d means a less dose. less dose. How much less dose? The small d means a low dose of the diphtheria toxoid. It is only less than 2 limits of flocculation. Less than 2 limits of flocculation. So please note, in Government of India under the National Immunization Schedule, are you giving, if I ask you a question, are you giving TT or TD or a TD? I hope you understand we are giving a low dose diphtheria. That is question number 1 for you. Point number 2, what is the schedule that we follow? Please note that the 10 to 16-year-old children, they will get a TD vaccine. It is also given to all pregnant females. All pregnant females will receive how many doses of vaccine? They will receive 2 doses of TD vaccine. It's a small d, okay? Low dose diphtheria. All pregnant females will receive 2 doses of diphtheria, tetanus toxoid and the diphtheria toxoid. In this, in case the female had received complete immunization within last 3 years, within 3 years, in those cases, the female is going to receive only a single dose. So please note that the Government of India under the National Immunization Schedule, we are saying that every pregnant female will receive 2 doses of TD vaccine, that is a low dose diphtheria and the tetanus vaccine. In case the female had already received a TD vaccine just within 3 years, now because there is a risk of hyperimmunization with the tetanus toxoid, so to prevent that, we say that in case the female had taken within 3 years, she gets only single dose. But everybody will get at least 1 dose of the TD vaccine. What is the side effect of the TD vaccine? It does not cause major side effects. It can have anaphylaxis or things like this, but it can also cause within some weeks to months, it may lead to a long-term side effect, that is brachial neuritis. So this could be a kind of a long-term or a mid-term side effect. You can say that it ranges between weeks to months for a patient to develop brachial neuritis. So now let us write down what you need to remember for your exams. I have just zoomed out of the slide. You can just refer to the previous slide if you want to, if this is not clear. TD vaccine. So we are going to talk about the TD vaccine. Please note that TD vaccine is one of the only known toxoid vaccine, mixed toxoid vaccine that we have in Government of India. Then it is the dose. Dose is 0.5 ml. It is given as intramuscular injection. It is given where? Please note it can be given on the deltoid is preferred because it is given to age more than 10 to 16 years, right? So deltoid area, the age, there is no standard age for it. And the side effect is brachial neuritis. Neuritis is the side effect of TD vaccine. Beta, what you see right now is what is the summary table. You need to remember every word has been asked in your MCQ exams. And now again, another way to summarize the whole game is what are the different sites of injection. If you see that this is the right side and the left side, what are the vaccines that we need to give in the left upper arm or in the left arm? Please note it is 2 vaccines. We give the BCG plus the JE with the star mark. Why star mark? Because it is given only in the JE endemic districts. In the left leg, in the anterolateral thigh left side, we are going to give what? The pentavalent vaccine, the hepatitis B vaccine and the DPT vaccine. In the anterolateral thigh right side, what is the vaccine that we are giving? The pneumococcal conjugate vaccine, which is given as intramuscular injection in the right anterolateral thigh. What is the vaccine that you're going to give in the right upper arm? In the right upper arm, it is only 2 vaccines again. We are going to give the measles or the measles rubella vaccine with the fractional dose of IPV. So that's what you need to remember. And of course, the oral vaccines. What are the oral vaccines? We will have the oral polio vaccine and we will have the rotavirus vaccine. So that is the oral vaccines. So this is what you need to summarize for your exam about these vaccines. Another area where the examiner might quickly test us is regarding the unimmunized child. Please note that I'm not getting into the unimmunized child because we have a whole together new module, new video session coming for any age group unimmunized child. So we'll be talking much in detail in that video module. Right now, I just want to sensitize you because there can be questions coming to you by the government. And there might be questions which you ask me every time regarding the unimmunized child. I want you to understand that if you look at this universal immunization program, what is the vaccine that you're giving at 9 months of age? First point. So a lot of questions coming on unimmunized over here, just basic stuff. If you look at this vaccine immunization program, what is the vaccine that you're giving at 9 months of age? At 9 months of age, we are going to give many vaccines. We're going to give the Japanese encephalitis first dose. We're going to give the pneumococcal conjugate vaccine. We are going to give the vitamin A. We are going to give the MR vaccine, which is the first vaccine. Please note that the priority vaccine at 9 months of age is always the measles rubella, because you're going to give that particular vaccine at the first point. So that is important. So whenever you are comparing between a primary dose and a booster dose, primary dose will always take more advantage. Second point, always mind the gap. Always mind the gap. Mind the gap. So please note that mind the gap means what? That there has to be gap between some of the vaccines. For example, whenever we are talking of the measles vaccine or the measles rubella vaccine, there should always be a gap of 4 weeks. If we are talking about whenever an unimmunized child we are having, so whenever we are talking of the pneumococcal conjugate vaccine, the gap is not 4 weeks, it is 8 weeks. Next, if we talk about the Japanese encephalitis, gap is not 8 weeks, it is roughly around 3 months, that is 12 weeks. That is 12 weeks gap for JE should be there. Please note that when you are giving DPT vaccines, what is the gap between DPT vaccines 6, 10 and 14? That is 4 weeks. So the primary doses should be spaced by 4 weeks. But the point is that the DPT booster dose, the point is regarding the DPT booster dose, it should be more than 6 months from the primary dose. This is what is the question for unimmunized child. So when are you going to give a booster dose for DPT in unimmunized cases? We are going to give primary doses 6, 10 and 14 or whatever, like 0 week, 4 weeks and 8 weeks. You give with a gap of 4 weeks, and then the booster should be given after 6 months of the last dose. That is for the DPT booster. Coming again to the OPV booster. So OPV can be given as 0, 1 and 2, and then it should be approximately ranged more than 12 months from the last dose of the OPV booster. So that's what is about the booster. So you need to remember about the gaps. Please note, this has been asked so many times in your exam. What is the gap between measles vaccine, between the pneumococcal conjugate vaccine, and between the JE? You cannot afford to forget this. So that was, I told you about 2 questions. Question 1 about the priority of the vaccine specifically at the 9 months, and second about the mind the gap. So that was regarding point number 1 about the priority of the vaccine at 9 months of age, and second point was regarding the mind the gap. There is a third point which you need to understand. Point number 3 is regarding the maximum age of the vaccines and how do we give the vaccine, like what is the package system of the vaccine. Just listen to it now. See, if I just show you the UIP where we had already discussed about the universal immunization program, you can see that at 6 weeks, what are the vaccines we are giving? We are giving at 6 weeks of age, we are giving OPV plus Penta plus Rota plus FIPV and plus pneumococcal conjugate vaccine. We already did this, what is the max age? So this thing you need to remember what is the max age, right? You need to remember the maximum age for all these. Okay, so now let me just tell you one more point regarding the package system. If a child will come to you at 6 weeks of age, beta, what is the vaccine you're giving? You're giving a pentavalent one, you're giving a OPV one, plus you are giving rotavirus one and pneumococcal conjugate one and FIP one. So all the ones are given at 6 weeks. Then there will be some 2s at 10 weeks and then all the 3s will be given at 14 weeks. Are you able to get this point? So all the vaccines are given in a package system. Try understanding. Let us say a child comes to you at 6 weeks and he has taken at 6 weeks. Let us imagine at 6 weeks of age, the child had taken only the oral polio vaccine plus they had taken the pentavalent vaccine. So they had taken OPV1 and pentavalent 1. They did not take the FIPV and they did not take the pneumococcal conjugate or the rotavirus. So now at 10 weeks when the child will come, we'll give the OPV2 and the pentavalent 2, but we will not give the FIPV1. Because try understanding, it's very difficult to explain the ANMs or the nurses or other immunizing people about this system. So we always say that this whole thing comes in a package. At 6 weeks, if you take all the vaccines, you will receive all the vaccines in the subsequent manner. If you take only half vaccines in the 6 weeks, then you can't come back at 10 weeks and say you give me the remaining from 6 weeks and the new from the 10 weeks. Are you able to get it? That will cause hodgepodge things about the national immunization schedule. So that's what I'm trying to explain to you, that under the national immunization schedule, this is what is a package. It comes as a package. 6 weeks is a package. You take all the vaccines or you leave the vaccines. So if a child is unimmunized and you give only few vaccines, or he was partially immunized, you continue with that only. That's what is important for you to understand, that in the unimmunized system, there is a maximum age for every vaccine and there is a package system for all the vaccines. So with that, I think we have covered most of your basic questions in the national immunization schedule. In the subsequent modules, we are going to talk about more about vaccines and strains and the cold chain.
Hi guys, please subscribe my channels.